We've seen that educators and families are satisfied with the service. Educators really appreciate and respond to the collaboration that's happening with the occupational therapist. They endorse the model. They embrace working with the occupational therapist. We see that school principals and school board administrators routinely say that the service is an incredibly valuable asset to the school community. We see that the occupational therapist truly becomes a part of that school community and is viewed as one of the staff and just people in the school, and that the service is seen as, this is now how our school is. We have heard incredibly powerful stories from occupational therapists, and I'm going to tell one because to this day, it actually makes me emotional. So in one of our earlier studies, maybe in 2010 or 2011, I was actually an interviewer, and I interviewed therapists who had done Partnering for Change. And I'd asked a therapist to describe to me what doing Partnering for Change had meant for her and how it had influenced her. And she said, I'm going to use the analogy of the Little Red Schoolhouse. And she said, normally when I've done service, I'm somebody who's outside that schoolhouse. I'm a visitor. I fly in and I fly out. Nobody knows my name. Nobody knows really if I've been there or not. I see a few children who are on my caseload, but I'm not necessarily part of it. I'm outside of it. And she said, and now, and I'm actually, going to get emotional. I'm sorry. She said, I'm in the schoolhouse. Everybody knows who I am. I get invited to things. I go to the staff barbecue. The bus driver knows who I am. The custodians know who I am. Families know who I am. I am a part of something. And she said, I've never felt a part of something before. And this has changed everything. That is why I'm like, this is so much better. So why is not everybody doing it? And everybody is not doing it because we really have only thought about funding a service for an itinerant service. We really have only thought about servicing children on wait lists. We have places in Ontario where the wait list is 10 years long. So clearly there's not enough resources, because otherwise we wouldn't have those wait lists. And Partnering for Change can address the needs in the system. It can change the system. It can provide a much more robust service. It can support students in ways that students have never had support before. But it requires an investment in personnel. People will actually add additional investment of funding and resources, and they pilot it, and they're putting occupational therapists into that model in a regular and consistent way. We've seen through our current research that regularity and consistency is about at least a service that's once every 2 weeks to that school. What tends to happen, not in all situations, but in many, is that once the study is done or the pilot phase is done, there aren't enough therapists to have everyone go and have all schools receive a service that's once every 2 weeks. So I would advocate and suggest we actually have a huge underinvestment in school-based services. And this would be true not just in Ontario, it's true in other places as well. And that if we think about implementing Partnering for Change, I think what we're asking for is a reasonable amount of money to provide an incredibly impactful service that has multiple demonstrated positive outcomes over multiple studies and multiple years. We know that researchers have implemented P4C who are not part of our team, but they've implemented in other countries, in other provinces in Canada, and have replicated our findings when it's implemented in the way that we've done it, with the consistency of the service and the embeddedness in the school and the focus on collaboration. So I think that if we ask therapists to do Partnering for Change or any tiered model, but we don't change the amount of resources invested, they aren't going to be able to deliver any version of this, and they still will not even have the resources they need to do what has been the standing model for decades. So I think fundamentally we have to say, what is the resource required to actually have a feasible model of any kind? And I would argue that Partnering for Change is the best model available to have the greatest impact. I have come to a place where I think we need to advocate that school matters. Students' educations matter. Education is identified as a major social determinant of health. Having a quality education and being able to participate and function in school and achieve academically and be successful and included and belonging is known to be so important for kids' futures. And I think we need to acknowledge these things are important. Kids' futures are important. And Partnering for Change is one part of the entire bigger argument. We need as a society to invest more in children. I think this offers an opportunity because it has impacts on two very important systems. If we're worried about funding problems, this is an opportunity for intersectoral collaboration and intersectoral funding, that if we looked at putting together resources across education and health and children's services, that would be the first place to start to see how could we fund this appropriately, and recognizing that this impacts multiple systems and therefore is worthy of funding by multiple systems.